Now we will look at the thoracic vertebrae. And the thoracic vertebrae are defined by their association with the ribs. Let's look first at the general characteristics of these vertebrae. Here we see a typical thoracic vertebra. The body tends to have a heart shape, as you can see in this example. We, of course, have the vertebral foramen. The vertebral foramen is going to be somewhat smaller in comparison to the body than that of the cervical vertebrae. This reflects the fact that greater weight is going to be borne by the body of the vertebra as we go from the cervical to the thoracic region, and also the spinal cord is going to start to get smaller. So the relative size of each is going to change, with the body becoming larger and the vertebral foramen becoming smaller, and we'll see this trend when we get down to the lumbar region. We have our neural arch, which consists of the pedicles and the laminae, and here is the spinous process. Transverse processes, we'll note, have a special characteristic associated with their articulation with the ribs. And here we can see the superior articular processes, on which you can see the superior articular facets. And note how they are facing posteriorly. This is an inferior view of our typical thoracic vertebra, and from this view we can see the inferior articular facets on the inferior articular processes. Notice how they're facing anteriorly. I like to turn to this drawing of a typical thoracic vertebra to again point out the superior articular facets, but also to note that on the transverse processes you can see articular facets, and also there are facets on the body. We can get a better appreciation of all these facets if we look at a lateral view of our typical thoracic vertebra. Notice how the spinous process is fairly long and is pointing somewhat inferiorly. And here again we have our superior articular facets, and you can't see them very well from this perspective, but here would be the location of the inferior articular facets. But notice now we can also see more clearly the articular facets on the transverse process, and we can see the facets that are on the body. The facets that are on the body are going to be referred to as demi-facets, which translates into half facets. The reason for this terminology will become clear soon. Again, what defines the thoracic vertebrae is their association with ribs. So now we'll look at the rib cage and its association with the thoracic vertebrae. Here we have a posterior view of the thoracic vertebrae and the rib cage. And if we zoom in on an individual rib, the only anatomy we need to know at this point is the head, which is this wide end, and the articular tubercle. The head is going to have facets which are going to articulate with the demifacets on the bodies of the thoracic vertebrae. And we can see here there are two facets at an angle with one another. And there's also going to be a facet associated with the articular tubercle. And this facet is going to articulate with the transverse process of the thoracic vertebra. So here again is our rib, and we can see the head and the articular tubercle. And we're going to put this against the thoracic vertebrae. So here we have two thoracic vertebrae. Now in this location where the rib is removed, we can note a demifacet and the articular facet on the transverse process. Again, here's the head, and it is articulating with demifacets on the bodies of the thoracic vertebrae, which are covered by the head. And the articular tubercle is articulating with the facet on the transverse process. So here again is our typical thoracic vertebrae, and we can again note the demifacets. There's a demifacet associated with the superior side of the body and a demifacet associated with the inferior side, and here is the articular facet. But now we should note that there is some variability with this typical thoracic vertebra. Here we can see the first thoracic vertebra, T1, and the typical thoracic vertebra goes from T2 to T8, which is not shown. But then we see T9, T10, T11, and T12. The vertebrae that are shown are going to vary from our typical thoracic vertebra formula. So let's look at the variation. So here is T1, and we can see that there is a whole facet on the body of T1. The head of the first rib is only going to articulate with the body of T1. The second rib is going to share an articulation with T1 and T2, so T1 is going to have a demifacet that reflects the sharing. Now if we look at T9 to T12, first let us note that although you find an articular facet on the transverse processes of 9 and 10, there is an absence of an articular facet on the transverse processes of T11 and T12. Now, if we consider the facets on the bodies of these vertebrae, we find a demifacet on the body of vertebra T9, and we see entire facets on the bodies of T11 and T12. This is going to be fairly consistent. In this particular example, we see also an entire facet on the body of T10. However, there's variability in this. In other words, although in this figure it looks like the head of rib 10 articulates only with the body of T10, this can vary where the head of T10 is going to overlap the bodies of T10 and T9, so that you'll find demifacets on both T10 and T9 instead of just seeing one whole facet on T10. We'll see an example of this in just a second. So here's a very nice STL file, a stereolithographic file, which allows you to manipulate the image in 3 dimensions. And we can use this image to take a closer look at the relationship of the heads of the ribs to the thoracic vertebrae. So using this very nice file, we can actually go inside the rib cage and get a close look at the bodies of the thoracic vertebrae and their relationship to the heads of the ribs. So here we have the bodies of 1 through 11 that we can clearly see. 12 is a little bit off screen. The arrows indicate the places where the head of the rib is straddling the bodies of 2 neighboring thoracic vertebrae, so that the heads of the ribs are articulating with demifacets. If we look more closely at T1, the first thoracic vertebrae, we can note that the head of the first rib has a full articulation with the body of T1, and the second rib is going to overlap the bodies of T1 and T2, so that we'll find demifacets on T1 and T2. Now, if we move over to the other end of the thoracic vertebrae and look at the bodies of 9, 10, and 11, we can note that the 10th rib, the head of the 10th rib, in this example, is straddling the bodies of T9 and T10, so that on T10 we're going to see a demifacet instead of a full facet. T11, as would be expected, is going to have a full facet, and so would T12. This brings our video on the thoracic vertebrae to an end. In the following video, I'll talk about the anatomy of the ribs and the rib cage. As always, if you would like to take a quiz, there is a link to a quiz in the description below. And here are the image attributions. I did not bother to list the images that are in the public domain. They come from Gray's Anatomy. Finally, here is the first of a two-part video of Apollo hunting a plastic folder tab.